and we are live. Hi, everybody. Just giving ourselves a few minutes now to make sure that everybody can join us, and we'll get this webinar going. Let's have a wee look. There are a couple of people online, so hi to everybody in the chat. If you have any questions this evening, if you pop them into the chat window there for us, we'll have the lovely Wes with us this evening, who's going to moderate the chat and let me know any questions that come up during the webinar, so that when we get to the question and answer section, help me make sure that I answer everybody's questions and no one gets missed. So say hello in the chat. Let us know where you're from so I can say hi if you haven't signed in anyway. Make sure you hit the play button. Okay, we've got 3 more viewers now. Good evening, everyone. Hi. If you have stumbled upon this webinar by accident, hopefully you are here for the Ultimate Back Pain webinar. If not, sorry, I'm not doing any macrame or any crocheting this evening. This is all about back pain. But if you're looking for the back pain webinar, you've come to the right place. Just a few more minutes and when we'll get started. Make sure you say hello in the chat. The chat window is underneath here. It should be right below this little video window down here. So if you want to ask any questions during our Q&A session later this evening, make sure that you pop them in that window, and Wes will let me know if you've asked any questions, so hopefully I can answer them for you, okay? I have us at 9:02. We're just going to give it one more minute and then we'll get started. There we go, that's a bit better. Now you guys don't have to see me being reflected back in my glasses. Okay. There we go, a few more people join us in the chat. So if you want to join in with the Q&A session later on in this webinar, please make sure that you sign into the chat window that's underneath here, it's down below here, and let us know if you have any questions. We'll just give it one more minute. Okay, 9:03. Once it hits 9:04, I think we'll get started. So hi everybody, if you're just joining us, you should be here for the Ultimate Back Pain webinar, which is being hosted by the Dynamic Bodywork Academy. So if that's what you're looking for, fantastic, you're in the right place. Otherwise, you've stumbled upon the wrong webinar, so you might want to keep looking. Excellent. Hi, Joanne. Welcome to the webinar. If you have any questions tonight, please pop them in the chat window below. And when we get to the Q&A session, hopefully we'll be able to get the answers for you. Okay, so I think we will go ahead and get started. So good evening, everyone. If you don't know me already, my name is Sally Chamness, and I will be your host this evening. I am hosting the Ultimate Back Pain webinar through the Dynamic Bodywork Academy. So hopefully tonight I'll give you at least one fact or one helpful piece of information that you can take away and use in your practice tomorrow. Or maybe I can give you some suggestions that might help you build a better relationship with the healthcare workers and GPs in your area, so that you can build that nice referral network and start helping people who are suffering from back pain. So what we'll do is we'll just hop on over to the screen share, and hopefully you guys will get to see my little presentation. Okay, there we go. Ta-da! So this is the Ultimate Back Pain webinar, and I am your host this evening. My name is Sally Chamness. I am the founder of Dynamic Bodywork Academy, and along with my partner Gillian, we are trying to bring to you some more advanced techniques in bite-sized form so that you can pick and choose the education that you need that custom fits the type of massage practitioner that you want to be. So the Ultimate Back Pain webinar, what are we going to cover this evening? Here we go. So we're going to talk a little bit about back pain, of course, because that's why we're here. This is the Ultimate Back Pain webinar after all. We're going to look at what the currently available treatments are for those suffering from back pain. We'll have a little look at some statistics relating to back pain in the NHS. And then I have a little case study to show you with one of my own clients who suffers from kyphosis. And we'll talk a little bit about some of the visible attributes we can see in his particular case study that might help us when we are assessing our own clients for back pain, and how we can go through and use different techniques to properly assess people who may be suffering from back pain. We are going to talk a little bit about how to get down with your GP's practice. So basically how to break down those barriers and create a great working relationship with GPs and other healthcare practitioners in your area, so that you can hopefully get yourself a nice referral network and start working with those people who have been experiencing long-term back pain and try to get them back on the road to recovery. Finally, we'll have a little Q&A session. So while we go through this webinar tonight, if you do have any questions, please pop them into the little window that's just underneath the box there, and Wes will help facilitate the chat this evening. All right, so let's get going. What is back pain? Okay, so there are many different types of back pain that people may experience. They can be categorized in different forms as well. The main characteristic for back pain generally comes as a mechanical problem. Now, these come in the form of a disc breakdown, muscle spasms. It could be tension in the muscles within the back itself. It could be ruptured discs. They can also be injury-related back pain. So this could be from sprains, strains, fractures, accidents such as car accidents, things like whiplash, could be falls down the stairs. I have had a client who unfortunately experienced some back pain after reaching over to unplug her Christmas tree lights. So they can range from very severe accidents to very small little movements, and can leave our clients in very debilitating pain. Other reasons that people may experience back pain, it could be from different diseases and conditions. One would be kyphosis, and kyphosis is considered the excessive outward curve of the thoracic spine. Now, this is what we would generally call a humpback. So it's that large hump on the upper back that you'd see generally associated with older people. It's often referred to as dowager's hump as well. So we're looking at that large humpbacked curve of the thoracic spine. Another condition is lordosis, and that is sometimes complementary to kyphosis. It's considered as the excessive inward curve of the lumbar spine. So that is an excessive curve of the lower spine that can often lead to a pelvic tilt. It's that big scooped back part of the lower back itself. Scoliosis is another condition that can be related to excessive back pain, and this is considered the sideways curvature of the spine, and it can also be seen in two different forms. Scoliosis can sometimes be viewed as a C curve, where there is a shortening or tension on one side and a stretch on the opposite side that makes it look like a C. or it can be also considered as an S-curve, where there would be 2 points of scoliosis on the back, an upper one and then a smaller lower one. More conditions that can relate to lower back pain. Spinal stenosis is another one. That is considered the narrowing of the space between the vertebrae. And as the space between the discs and the spine gets smaller, it causes a pressure on the spinal cord that can sometimes pinch the spinal cord itself, or it can also cause impingement on the nerves coming out from the spine. 75% of spinal stenosis occurs in the lumbar spine, so the majority of people who would be living with this condition would often experience lower back pain rather than upper back pain. There are other reasons why someone may experience back pain itself. That could be related to infections, to tumors. The majority of people that we often see in our clinics who may not have a physical reason for experiencing back pain, it can often be related to stress. It can be a physical manifestation of stress. So the list goes on and on. People with kidney stones can experience the pain from the kidneys in the back. People who suffer from fibromyalgia may also experience back pain. One of the things with back pain is that it seems to be the nucleus in the body. So it seems to be the central point for all other pains in the body. And it can be a source of referral pain. So it could be injuries or conditions in other areas of the body that aren't part of the back itself that can create referral pain that you experience as back pain. As they say, everything is connected depending on the kinetic chains. If you look at kinetic chains, whether you practice trigger point therapy, there are many things that can cause back pain in our clients, which makes it extremely important for us to do a thorough assessment when we're working with clients to make sure that we understand not just the site of the pain that the client is experiencing, but also the source as well, and many other attributes to the cause of this pain. It could be not just a physical manifestation, it could be something from a repetitive movement that the client is doing, or some type of environmental factor in their day-to-day lives that they haven't considered. Current treatment options for back pain. The number one treatment option for back pain in the UK is through pharmaceuticals. So 9 times out of 10 when our clients attend their GP because they're experiencing back pain, they'll receive a prescription for painkillers, potentially painkillers that also contain anti-inflammatories depending on the severity of the pain, and then sent their merry way and told to take the prescription and keep it till it gets better, basically. But as we all know, that taking medication to treat back pain will certainly take away the pain, but it's only treating the symptoms. It's not actually treating the cause. And that is pretty much why we are there. Some other methods of treating back pain could be with physical therapy, if clients are lucky enough to be referred to physical therapy by their GPs. Manual therapy, this is where we come in. Manual therapy can be considered as massage therapy, osteopathy, chiropractic work, anything that under the complementary therapy umbrella that performs some type of manual manipulation of the soft tissue in the body would be considered manual therapy. And of course, another option, but a more severe one, would be surgery. Often surgeries are performed where it could be they remove a disc in the spine to relieve pressure and impingement in the case of stenosis. It could be teenagers receiving surgery to put rods into their back to help straighten a scoliotic spine. There are a lot of very severe surgeries, but as we know, when we do start cutting into the body and creating wounds from surgery, we start to weaken the structure itself. And me personally, this is my own opinion, I would always see surgery as a last resort. If we can create some type of intervention that is going to hopefully reduce a client's back pain and preferably get to the root of the problem without the need for surgery, then that's the best outcome of all. So let's look at the numbers. In an NHS study in 2014, they found that lower back pain was a leading cause of disability globally, affecting 1 in 10 people, and that number increases with age. So the older you get, the higher incidence of you suffering from back pain, which then leads to ongoing disability increases. The takeaway from that study there would be then not to get old. But unfortunately, we don't have that choice. So looking at how the NHS deals with back pain, the annual spend by the NHS to treat this issue is £420 million for back pain. £420 million. And breaking that down, here are some of the other numbers for you. £48 million per year is spent on prescription medication for people suffering from back pain. 63 million, surprisingly, is spent on physiotherapy. And then 45 million is spent on performing x-rays to try and identify the source of their back pain. But 48 million on prescriptions. Wouldn't it be nice if we could have just even 0.5% of that thrown our way to provide massage therapy instead of a prescription? How amazing would that be? 48 million. It's incredible. So as I said before, we're going to have a look at a little case study of my own from one of my lovely clients at my own clinic. And I want to introduce you here to Derek. This is my friend Derek, and he came to my clinic about 2.5 years ago. And these were the pictures that we took upon his initial assessment. Now, Derek suffers from Sherman's disease or Sherman's kyphosis, depending on how you want to label it. But basically, it's a congenital form of kyphosis. Derek was unfortunate enough to have been born with this condition. So having a look here, just initially, there are a lot of things that we would initially assess in regards to his posture. For one, we can see that he has, if you look at the lumbar spine, he has a little bit of a lordotic curve going on down here. But the main thing that sticks out is this big kyphotic curve up in the thoracic spine. Surprisingly, it doesn't actually look too bad, but you can see its effect on the anterior side there on the front of his body. It gives him that kind of sticky out belly. You see his shoulders are rolled forward, his neck leans forward. You can see that there is a tilt there in his hips. It's causing a bit of a pelvic tilt. And that's just a side view from looking at him. Let's have a look at some other pictures here. So on this left-hand side, you can see not only did he have that kyphotic curve, we can also see that there are some twists in the vertebrae down here, round about kind of T10 through T12. And there is a very vast buildup here on the right-hand side of some scar tissue that's been kind of building up over time to protect the spine because there's a lot of friction in that area from the curve itself. You can see he has a bit of scoliosis going on as well. You can see down here in the lumbar area, there's a bit of a C curve there. And then further up, you can see around that right shoulder blade that there's a bit of a C curve up here as well. There's also a little bit of winging in his shoulder. We could be here for days and days just assessing this one picture. I think it's a great specimen to have a look at, just the variation of his back due to his kyphosis. On the right hand side here, this is another view showing you how his abdomen sticks out, basically due to that lordotic curve. Going down, you can see again that kyphotic curve, and you see that his right shoulder there is rolled forward. And then as he lays down on the table, you can see the extent here of that kyphotic curve on his back. So having a look at these images, they can be pretty daunting in regards to assessing how we would treat this. Now, with Derek's condition, because it's congenital, there has been some permanent structural issues that we're unable to address through massage therapy. These are visible through some x-rays and MRIs that we had access to. However, we can still, and we have been able to affect his posture and improve the stability of his core and give him some pain relief. Now, because again, it's a congenital condition, that it's never going to go away completely, but we have been able to provide relief to him so that we are only seeing him whenever instances of pain occur. The initial treatment plan for Derek, we started off by seeing him for 30 minutes twice a week. And that went on for a period of 12 weeks. After that point, we actually reduced it to 1 visit a week, but increased it to an hour because we wanted to start incorporating larger areas of the body. Initially, the 30-minute treatments were to focus on 1 or 2 specific areas at a time. But as we increased the duration of the time, we slowly started to introduce additional areas of the body so that we could get a more holistic approach and start to rebalance things as we worked with him. So what kind of work did we do with Derek? So the rounding of the shoulders, obviously, to address this, we worked on the upper chest, we worked on the pecs, we assisted him with strengthening of the rhomboids and of the upper and middle traps to help hold and stabilize those shoulders. He performed stretching to help open up the pec area. We did some passive stretching with him initially, and then we performed some PNF as well in there to help strengthen that shoulder area up. In regards to the kyphotic curve on his back, if we have a look down here on the left-hand side again, this area here in this central back area, I like to call it the keystone because it kind of looks and feels like it's the keystone on a bridge. So surrounding the tissue here on his spine, we did a lot of myofascial work to try and break up a lot of this scar tissue. We had to be very careful because with the rotation here in the spine, it could often be quite uncomfortable for him. So the myofascial work only lasted for a short period of time in the initial portion of the treatment. But that was to reduce this large hump that you see here on the lower right-hand side. We also worked on loosening up this lordotic curve here on the bottom. And to do that, we did some abdominal work as well to help build the muscle tissue, the muscle density in the abdomens. And he did a lot of core work to help strengthen that. By doing so, it helped pull that tummy in. It helped straighten up that lordotic curve a little bit there for us. And then following on from that, as we came down the body, we worked a lot on the hip and pelvis to try and straighten up that pelvic tilt. So about 2.5 years on now, unfortunately, I don't have an after picture for you, but I can tell you that we've successfully got Derek down to receiving treatment only every 6 to 8 weeks now. And what I can do in the follow-up when I include the replay of this information, I will do some follow-up pictures for you. I have an appointment with Derek later this week, so we'll take some pictures and get those posted so you can have a look. So depending on the type of kyphosis that your client has would depend on the treatment plan that you create for them. You'll want to make sure that you assess all the different areas of the body. You want to look at the different points, for example, between the shoulder and the hip, the alignment here. You want to look at the alignment between the ears and the shoulder, and build your treatment plan, kind of going through the body, working each area so that you can bring it back into alignment. Whether that be from massage alone or a referral to someone who can prescribe strength training or stretching, or if in cases like this you may need to seek assistance from an osteopath or a chiropractor if there are structural issues that they need assistance with, then it would be advisable to do that as well. So alternative treatments for Derek. Derek did spend some time visiting with a chiropractor and an osteopath. However, the severity of the congenital condition meant that manipulation wasn't advisable in the area where he had those twisted vertebrae. So we do just maintain work on him in the musculature of his body and try and make him more comfortable in that arena. But these are things that we would find that our GPs often, if they feel that either surgery is not an option or they feel that they're really not sure that they can make an impact on this, they would throw some painkillers at this condition and send them on their way, which is what they did with Derek. They felt that he wasn't an appropriate candidate for any type of surgery, so he was given a repeat prescription for some heavy dosed painkillers and wished good luck. It can be frustrating as a massage therapist when you feel and your client feels that they haven't been addressed properly, or their condition hasn't been addressed properly by their GP or other healthcare practitioners. But the only way that we can really reduce this issue is by building a good relationship with our GPs and with the other healthcare practitioners in our area. And although there are very few NHS regions that do employ massage therapists, that doesn't mean that the GPs aren't open to referring out to us or working with us when a client may need our services. Approaching a GP, however, can be a little bit scary. And most of the time you're not going to get direct access to the GP themselves. If you phone up to the health centre or you call your GP's practice and speak to the receptionist, 9 times out of 10, they're going to shut you down. That's their job. Receptionists are considered the gatekeepers, and they decide who does and does not get to speak to a GP. And to be fair, considering the constraints that our GPs are working under at the moment, that's understandable that they don't want to let just anybody off the streets through the phone speak to the GP. They do have to manage that a little bit. But who you actually want to speak to at your GP's practice is the practice manager. They're the middleman. They are the people who have direct access to the GPs themselves, and they can make the decision on whether or not they feel that the information that you have for them would be appropriate to pass along. Now, there are many ways that you can speak to the practice manager. You can give them a call, although sometimes that's a bit more difficult to explain what you want to talk to them about over the phone. You can send them a letter in the mail, normal snail mail. Generally, by email, they tend to be deleted. So you can send them a little letter in the mail introducing yourself, letting them know who you are and what it is that you do, and inviting them to get in touch with you because you'd like to chat with them about working with their practice in regards to assisting any of their patients who may be experiencing chronic pain. Now, if you don't receive a response from this, don't be disheartened. They receive a lot of mail every day, and sometimes you can slip through the cracks. If you find that you haven't received a response from the practice manager, either by call or by snail mail, you can sometimes head out to the practice yourself and ask to speak to them in person. And sometimes that's the best way to get your message across to them and get them to commit to having a meeting with you. And that's the first step of getting in your foot in the door in regards to your GP's practice, is getting the practice manager to agree to having a sit down with you, even if it's just 10 minutes for a coffee. If they are open to meeting with you in that manner, then your job's half done. Now, when that happens, what you'll want to do is you'll want to make sure that you're prepared with all of the literature and information that you can provide to them to show them that you are a consummate professional and that you are the person that their practice needs to refer their patients to. The best way to do that is to talk the talk. So what do I mean by that? We spend a lot of our time trying to dumb down the language that we use, as oftentimes the clients that we see don't understand what a lordotic curve is, what a kyphotic curve is, what spinal stenosis is. All these big words, they don't know about posterior and anterior, superficial. They don't know the muscles that we're working on or that we address. So we get out of the habit sometimes of using official names, official words with people when we're talking about specific conditions or we're talking about specific areas of the body. So when you're talking with the practice manager, and if you get the chance to speak directly with the GPs in the practice, it's very important that you speak to them on their level. You use language that they would use in their profession to talk about specific conditions or to talk about specific treatment options. In the literature that you provide in regards to the work that you do, it's also important that you use the same language in that. So if you are talking to them about back pain, for example, you want to make sure that you are talking about the structures or the muscles in the body in a medical sense. You're using medical terminology that shows them that you're professional enough to be able to speak their language. You want to make sure that you're educating not just your clients about back pain, but also the health professionals that you are talking with. And what I mean is, don't try and tell them that you know more than them. You just want to explain why you feel, for example, if you're referring a client on to a physiotherapist or referring them on to an osteopath or chiropractor, you want to be able to explain to them, again, in medical terms, why you feel that they are the best person to treat your client. The client, on the other hand, what you want to do is, again, educate them why you feel that these other health professionals you're referring them to is the appropriate person to work with them. But another way of educating the client is also to explain to them that back pain isn't always caused in the area where they're experiencing this pain. And by that is, sometimes you'll have a client who will attend your clinic and they are experiencing some chronic lower back pain. And it turns out after assessment that you find that they have a problem in their glutes. You find that they have some type of contracture, they have a shortening in the glutes, some type of compression, just a problem that a massage therapist can address by working on the hip and glute area. The client, however, doesn't really know about the connection between the hips and the back, or the shoulders and the back, or the hamstrings, or the quads in the back. So they're going to be lying on the table wondering why on earth you're working their hamstrings or working on their glutes when they don't have pain in their glutes and they don't have pain in their hamstrings. The pain's actually up in their lower back. So when you are working with clients who experience some chronic back pain, it's always good to explain to them the areas that you're planning on treating during their treatment, but also why you're going to work on those particular areas. It will put your client at ease, and it will also help them understand that pain that they experience doesn't always originate from the location that they're feeling that pain. Going back to working with healthcare professionals, if you have the opportunity to, if you work from your own clinic or your own space, you can often extend an invitation to either the practice manager or to your own GP, inviting them to come to your clinic and just have a little tour. Give them a tour, show them where you work, show them, the professionalism in your practice, and that gives you the opportunity in your own environment to talk to them about the work that you do. Often, if you're speaking with these healthcare professionals in their own setting, it can be a little bit intimidating, but when they're in your domain, you can be a bit more relaxed and a bit more natural, and maybe feel a bit more at ease when talking with them. And that makes things a little bit easier when you're trying to assure them that you're the best person for the referrals when it comes to soft tissue issues in relation to back pain and other soft tissue problems. If they're interested, you may even want to extend the offer of allowing them to receive a treatment from you. As a therapist, it's always great to receive a treatment so that you know who you're working with if you work with other therapists, or if you yourself need to experience some treatments from either chiropractor or an osteopath, or you're going to be working with these people on a regular basis. It's good to know how they practice, what type of work that they do, so that you have an educated opinion of the work that they do and can confidently refer clients to them because you've received work from them yourselves. The same goes for GPs and physiotherapists and the like. They'll want to know that the work that you do is amazing because, let's face it, you are an amazing therapist. So why not show them that by inviting them to receive a treatment from you? And then finally, have a look at local events boards. If you have a partnership centre, check out any events that may be coming up. Contact your local sports centres and just pay attention to local media to find out if there are any healthcare events taking place. Sometimes the NHS or healthcare communities like to throw events such as health and wellness days. They like to showcase their own offerings where they're trying to invite people to look at other services offered by the NHS Trust in that area. And that's a great opportunity for you to meet with them and also basically sell your wares. You can get yourself a little stall at the event, chat with people who are there to find out what is available in their area healthcare wise. And it's just a great opportunity to meet potential clients and also to meet other healthcare practitioners to help you build your referral network. Speaking of building a referral network, who do you want to have in that little black book of referrals? You want to have other manual therapists, so that's people like chiropractors, osteopaths, physiotherapists. If you can get contact details for the physiotherapists that are on your local NHS trust, that's fantastic. But you also might want to have a look around and find out if there are any private physiotherapists in your area. Sometimes if clients are unable to get a referral from their GP, they may want to extend their options to the private healthcare service. So there's no harm in collecting a list of local physiotherapists who work privately as well. If you are working with a client who you feel may benefit from some strength training or from some other type of personal training, it's great to have a list of personal trainers you can refer them to. And also find out the contact details for your local pain management clinics. You may find that this is an option that your clients haven't considered, especially if they're suffering from chronic back pain. That's back pain that has been going on for many, many weeks or many, many months, and they just feel that they're not getting anywhere with that pain at all. They may want to speak with someone at the local pain management clinic who can help them get into a program to investigate the source of the back pain and get them into a suitable treatment protocol with a variety of different treatments to help ease that pain. Okay, wow, that's a lot of talking. So now we're at the section of the webinar where we are going to have a little Q&A. So if you have any questions this evening, please put them in the chat window, and Wes will help me facilitate those. So I'll give you just a couple of minutes to pop in your questions, and hopefully I'll be able to get you some answers.
Sadly, no one's questioned anything yet. So, it's just been very thorough tonight.
Okay, you get to see my smiley face just for a few minutes while we have a look through some of these questions. Okay, let's see what we've got going on here. Nobody has any questions about back pain at all? That's okay, that's not a problem. We'll just give you a few minutes because I know there's a little bit of a delay at times in the presentation. This is where I should do a little dance to entertain you while we're waiting. Oh, I don't know why I'm putting myself on camera because you can get to see as well. I know I have posture problems. That's something I need to address. All right, here we go. Well, if anybody has been watching the presentation this evening and they do have questions about anything that I covered, you can always send me an email at info@dynamicbodywork.co.uk. I will just pull up the screen share again so that you can have a look at some of our contact options. So here we go. So if you want to know more about upper and lower back pain, or just really any information about the courses that we run or any of the webinars that we plan to do going forward, you can contact us at www.dynamicbodywork.co.uk. We do have two advanced technique classes for back pain, for upper and lower back pain. The first one will be on June 28th, and that will be at our Belper location, and that will be with our tutor Jeannie. And then the next one after that will be at our New London location, and that will be Sabina who's holding that class, and that class will be on June 26th. If you're interested in attending either of those classes, you can use the code webinar on our booking page, and that will get you £30 off. Normally our classes are £130, but using that code will get you the class for £100, and that code is valid through until Saturday at 10 a.m. So make sure that if you want to get a discount on either of those two courses, that you use the code webinar and you make your booking before Saturday. Again, you can find us on Facebook at facebook.com/dynamicbodywork. We're also on Twitter, twitter.com/dynamicbw. And then there's that email address there again. It's info@dynamicbodywork.co.uk. I hope you found this webinar interesting. I tried to give you as much information as I can. It ran a little bit shorter than I wanted it to. I was hoping that we would get some really interesting questions from people in regards to back pain. But again, that's okay. Some people are shy and they don't want to ask on air. That's not a problem. So send me your emails, ask me some questions, and when I do the write-up on the replay, I will get all the answers that you need. Hopefully you've taken something away from the webinar this evening, whether that is just finding it really interesting looking at one of my case studies, or taking away some ideas on how to get the process in place so that you can get some GP referrals. If you want more information about working with GPs and trying to build that relationship, then again, send me an email. I'd love to chat with you about that. But I think we're just going to call it an evening. Thank you all for your time. I've had a great time this evening, and I look forward to seeing you on our next webinar. Bye.